my name is Casey and this is Alex. She volunteered to be our patient today for the head to toe assessment. Prior to beginning the exam, we took her height and her weight, gathered a full set of vitals. We checked her distant vision using the Snellen chart and her near vision using the Rosenbaum chart, observing her cranial nerve function. She emptied her bladder, she changed into comfortable clothes, and I washed my hands thoroughly, and we will now begin the assessment. We'll first start with the general inspection of her head and her face. The skin is uniform in color. The scalp is normal cephalic. I will then palpate the head, noting that it moves freely, there are no masses, lumps, or lesions, and the hair is distributed equally. I will then palpate the facial bones, noting for any pain or tenderness, and I will palpate the TMJ by having you open and close your mouth, noting for any popping or clicking or pain, and none is noted. I will then test your light sensation by having you close your eyes and tell me if you can feel this equally on your forehead,
Yes.
your cheeks,
Yes.
and your chin.
Yes.
Good. I will then have you clench your teeth, puff your cheeks, smile, stick out your tongue, clench your forehead, and squint your eyes, noting that these are symmetrical and even throughout, noting cranial nerve function. We will then assess the eyes, looking at the eyebrows, noting that they have equal hair distribution and they grow towards the outer canvas, looking at the eyelashes that grow outward. Then we will look at the sclera and the conjunctiva. The sclera is white and the conjunctiva is pink and moist. I'll then have you stare at a spot on the wall and have you cover one eye and uncover, then cover the other eye and uncover, noting for any nystagmus or extraocular movements. I will then have you cover one of your eyes again, and I will cover mine, and please tell me when you can see my fingers.
See. See. See.
Okay, now cover your other eye.
See. See. See.
Good. Checking her peripheral vision. We will then have you follow my pen light through the cardinal fields of gaze, keeping your head stationary. Noting that the eyes transition smoothly through the fields of gaze with no nystagmus or extraocular movements. We will then test your direct and consensual pupil reaction. Direct and consensual, direct and consensual, noting cranial nerve function. We will then move on to the ears, palpating the auricles, noting for any pain or tenderness. I will then look at the tympanic membrane, noting that it is pearly gray with no swelling, and that the ear canals are clean. We will then test her hearing, first with the Weber test. I'll strike the tuning fork and place it on the top of your head, and tell me if you can hear it equally.
Yes.
Okay. We will then do the Rene test. I will strike the tuning fork and place it on your mastoid process, and tell me when you can no longer hear it.
Now.
Okay, and then I'll place it in front of your ear. Tell me when you can no longer hear it.
Now.
Okay. Air conduction should be heard 2 times longer than bone conduction. We will now complete the Weber test, or the whisper test, sorry. Testing for cranial nerve function, I'll say a word and I'll have you repeat it.
Apple. Orange.
Good. We will then move on to the nose, knowing that the nose is midline to the face. I will look inside the nose, looking at the nasal turbinates, looking at the mucosa, that it is pink and moist. There is equal hair distribution, and the sputum is midline. I will then check for patency. I'll have you block one of your nares and take a deep breath in and through the other. And good patency is noted throughout. We will move on to inspect the mouth, noting that the lips are pink and moist with no cracks or fissures noted. We will then look inside of the mouth, looking at the hard palate, the soft palate, the uvula, the tonsils, looking at the tongue, at the lateral sides, and the floor of the mouth, looking at the teeth, noting the color, number, and characteristics. We will then function. We will then palpate the pre-auricular, the post-auricular, occipital, the tonsillar, submental, and submandibular. We will then palpate the supraclavicular chain, the posterior clavicular chain, the deep cervical, the supraclavicular, the infraclavicular, and the auxiliary nodes, noting that there is no pain, tenderness, or swelling noted. We will then inspect the neck, noting that the color is uniform throughout. The trachea appears to be midline. We will then palpate the trachea, noting that it is midline. We will palpate the thyroid by having you swallow, noting that it transitions smoothly. I will then palpate the carotid pulses, one at a time, noting their rate, rhythm, and intensity, which are 2+ bilaterally. I will then check your range of motion by having you place your ear to your shoulder and your other side, chin to chest, and back to your, there we go. And then I will apply pressure, doing the same movements. And then I'll have you do the shoulder shrug, noting for cranial nerve function. I will then auscultate the carotid pulses with the bell of my stethoscope. I'll have you take a breath in and hold. Okay, breathe. Breath in and hold. Okay, breathe. And I will listen to the thyroid. Good. No bruits are heard. We will then move on to the inspection of the chest. Looking at the color of the skin, which is uniform throughout, there are no obvious pulses or heaves or lifts. I will then palpate the chest wall, noting for any pain or tenderness. I will palpate the cordium, noting for any heaves or lifts. Then the left apical pulse, noting the rate, rhythm, and intensity of the heart. And then I will palpate for tactile primitus by having you say 99,
99,
99,
99,
99,
99,
and 99.
99.
Good vibration is heard throughout. I will then percuss the chest wall. Noting for resonant sounds heard throughout. Okay, I will then have you put your hands on top of your head. We'll check the lateral sides, comparing side to side. Good. I will then auscultate the lung sounds. Have you take a deep breath in. Comparing side to side in a symmetrical fashion. Okay, then I'll have you put your hands above your head again. We'll listen to the lateral sides, comparing side to side. Good. We'll then listen to the heart, starting with the aortic, pulmonic, Erb's point, tricuspid, and mitral. S1 and S2 are heard throughout and no murmurs are noted. I'll then have you turn around. We'll inspect the back. First looking at the skin, noting that it is uniform in color throughout. We will then palpate, noting for any pain, tenderness, or lesions. I will then palpate for tactile primitus by having you say 99.
99, 99, 99, 99.
Good vibration is heard throughout. We will then percuss. Noting for resonant sounds heard throughout. We will indirectly percuss the costovertebral angles, which should not elicit any pain. I will then check for expansion by having you take a deep breath in and exhale, noting that the hands move symmetrically. I will then have you lean forward, and we will percuss down. I will have you take a deep breath in and hold, and we will percuss down, Waiting for that sound change, you can breathe. And then I want you to take a few deep breaths in and exhale and hold. And we will percuss up until we hear that sound change again. And we will do this bilaterally. You can breathe. All right, we will then listen to the lung sounds again. Listening in a symmetrical order. Having you take deep breaths in and out. No adventitious breath sounds are heard. All right, you can lay down on the pillow for me. We will begin by examining the abdomen. I'm going to just raise your shirt. Looking at the contour of the abdomen, noting for any obvious heaves or pulsations, which none are noted. We will first begin with auscultating the abdomen, listening to all 4 vowel sound quadrants. You may need to listen up to 2 to 5 minutes if no vowel sounds are heard. And good vowel sounds are heard throughout all 4 quadrants. We will then switch to the bell of the stethoscope and listen to the aorta, the renal arteries, iliac, femoral, noting that no bruits are heard. We will then percuss the liver border on the right side. And then we will percuss the spleen. We will then lightly palpate the abdomen, noting for any pain, tenderness, masses, or lesions. We will then deeply palpate the liver border. And we will attempt to palpate the spleen, which you should not be able to feel. We will then palpate the kidneys and the aorta. Good. And then I will have you lift your head slightly off the pillow, and we will palpate the abdominal muscles. Good. All right, you may now sit on the side of the bed for me. We'll look at the upper extremities, noting the skin color is uniform throughout, the temperature is warm, and there is equal hair distribution throughout. We will check the brachial pulses, noting their rate, rhythm, and intensity, which is 2+ bilateral, and the radial pulses, which is 2+ bilateral. We will look at the fingers, checking for capillary refill, noting that it is less than 3 seconds, and that there is no clubbing, and there is no edema noted. I'll then have you put your arms out like this, and push up, and push down, and put them in front of you, push up, and down. Good. We will then move on to the lower extremities, noting that the skin color is uniform throughout, the temperature is warm, and there is equal hair distribution. We will palpate the popliteal pulses, the tibial pulses, and the pedal pulses, noting their rate, rhythm, and intensity, which is 2+ bilateral. I'll then have you push up with your feet and push down. Good. I will then test your sharp and dull sensation. Please close your eyes and tell me what you can feel.
Soft, sharp, soft, sharp, sharp, soft, sharp, soft, sharp, soft, sharp, soft.
Good. I will then test your reflexes, your brachial, your radial, brachial, and radial, then your knee, and your Achilles. I will then have you stand up for me and turn around. We'll first just inspect the back, noting that the spine is midline and no obvious deviations. I will then palpate the cervical spine, the thoracic spine, and the lumbar spine, noting for any pain or tenderness. I will then have you lean forward and dangle your arms, looking for any kyphosis or scoliosis, and none is noted. All right, that will complete our head-to-toe assessment for Maryville University.